Greetings and a warm welcome to everyone. This is Rupsha, the assigned moderator from ClearNet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us across the country. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us on today. Now, allow me a moment to introduce our platform, ClearNet. Stands as one of the largest live digital semi platform in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's eminent speaker, Dr. S. Arulraj sir. Sir is MBBS, MD, PhD, FRCP, GNL. He is currently associated as Head of Acute Medicine in Sundaram Arulraj Hospital, Tamil Nadu. I would like to take this opportunity to provide a brief overview of today's topic, which is living well with hypertension. Hypertension defined as persistently elevated systolic blood pressure more than 140 mmHg and or diastolic blood pressure at least 90 mmHg affects a significant proportion of the population worldwide. Lifestyle modifications are the cornerstone of the prevention and treatment of hypertension. Lifestyle interventions such as dietary modifications, alcohol moderation, avoid smoking, physical activity, and stress reduction may not be only reduce blood pressure and improve hypertension control, but also improve the cardiovascular and overall health. So, without any further delay, sir, I would like to hand over this topic to you. Kindly proceed with your talk, sir. Over to you.
Warm good evening to all the delegates and participants from India. I am thankful to Clarinet for bringing this topic to our medical fraternity. Hypertension or high blood pressure is a very commonly used terminology, common disease also. We call it as a silent killer. Why? Normally people say that I don't have giddiness, I don't have hypertension. That is not the right thing. Ultimately, they will end up with a myocardial infarction or a stroke or a renal failure with uremia, and finally they will come to know that it is hypertension. That should not happen. That is why this particular communication is there. Once they are detected that it is hypertension, everybody gets depressed. Oh, I have got hypertension, I have to take drug therapy. No. This is how to live well with hypertension. That's what I am going to highlight to you all. In the brief communication here. See, what is blood pressure is always indicates overall health. See, there is, the blood vessels, there is a vessel going on, elastic vessel, inside which, blood is flowing. As though water flows in pipes, it is flowing inside our body. Right from the heart, it goes to the, blood vessels and goes through from head to foot. These, blood has a, pressure effect on the blood vessel, or the blood vessel has a pressure effect on the contents because it is elastic. It is keeping it in order so that it flows. It flows. When that pressure is high, we call it as a high blood pressure. When it is low, we call it as a low blood pressure. There are many causes like family history, age, center, but as told by the, moderator, smoking status, alcohol, all are very important causes for it. When you say that it is hypertension, high blood pressure, as I told you, and usually when it develops, it is lasting for years together. Whether you have symptoms or not, you need to check and see that you have blood pressure or not. This is the official definition of American Cardiological, Society, and then AHA. Hypertension is defined when the systolic blood pressure is more than 130 millimeters and diastolic pressure more than 80. And a diagnosis requires multiple measurements, whether at home or hospital. In the epidemiology, what is the current scenario of the incidence? Nearly 1.13 billion people all over the world have hypertension. And usually about 7 million deaths are taking place in a year. And most important cause of premature death is hypertension. Young chap suddenly brought with a stroke, suddenly brought with intracerebral bleed. He didn't know that he had hypertension, 40 years, 30 years. And he comes to the emergency department with a chest pain, acute myocardial infarction. They are all the common presentations. And hypertension is the number one cause for heart failure, stroke, and then secondary cause for, renal failure. This is the global burden as it is. And what is the projection? About 26.4% of the adult population have hypertension as of date. And the projection for 2025 is it will go to 29.2. Now there are about 972 million, less than 1 billion, whereas it will be 1.5 billion 2025, and 20% will be in developed nation, 80% will be in developing nation. That is where we are important. India is a developing nation. Our incidence of hypertension will go up, and the economy will definitely be affected by these people. And this is a very important, very interesting, analysis and data. See, in a population, when there are 100% of population, only roughly about 20% of them have hypertension. 80% are normal. Of these 20%, those who are diagnosed with hypertension are only 32%. Of these diagnosed hypertension, 29% are only getting treated for hypertension. Of these 29%, only 29% of people are, under control because of treatment. The undiagnosed hypertension is about 60 to 70%. Overall, only 15.4% of hypertensive people only have their blood pressure control. That is why it is the commonest cause still for premature death. These are the rates of hypertension in India. What I told you is, global data. India data, out of the 100% of the population, I'm aware that those who have hypertension, around 27%, on treatment 14%, under control is only 12.5%. It is much lower than compared to other parts of the world. These are the various criteria, normal. There are so many, denominations or numbers by so many organizations, but this is the final approved level. Normal, less than 20 systolic or less than 80 systolic, and there nothing is needed for these people. When it is elevated up to 29, and when it is hypertension stage 1, 130 to 139, these people healthy lifestyle and one of the drugs can be used. In hypertension stage 2, more than 140, diastolic more than 90, you need 2 BP lowering drugs. There are 2 important situations why we are concerned about hypertension. One is hypertensive urgency and emergency. What is urgency? What is emergency? Both are same. Blood pressure is very high. Systolic is above 180, diastolic is 120. But the difference is in urgency, there are no target organ damage, TOD is not there, whereas in emergency, target organ damage is there, right from, brain, eye, cardiac, renal, all. On these people, you need to reduce the blood pressure immediately by intravenous, drug therapy. Hypertension-related cardiovascular mortality is very high. Both in rural areas and urban areas, more so in rural areas, it is going on increasing, right from 2000 to 2017, going on increasing. Hypertension-related mortality is going on increasing. When there is a reduction in the blood pressure, you say it is going on increasing. When there is a reduction in the blood pressure, or the risks are reduced, yes. It's a very interesting study. The major cardiovascular disease, when blood pressure is reduced by 5 millimeters, the risk is reduced by 10%. When it is reduced by 10 millimeters of mercury, it is 20. Like that, stroke, heart failure, ischemic heart disease, and cardiovascular death, all of them are even reducing 5 millimeters of mercury, reduces at least 10%. When 10 millimeters of mercury blood pressure is reduced, it reduces the complications, including death, at least 20%. That is why it is important to treat and see that blood pressure is under control. This is JNC, 8 classification. Almost it is there. Stage 1, stage 2, we have said. Below 120, normal, above 130, it is, raised blood pressure. These are the various types of hypertension which we commonly use it. One is called essential. We don't know the cause. Earlier it used to be said as idiopathic. Now we don't use the terminology idiopathic in medicine. It's primary hypertension. Secondary hypertension can be due to renal or a coarctation of the aorta or a cardiovascular disease. Another is a resistant hypertension or stubborn hypertension. You have used more than 3 drugs, still BP is under control. White hot hypertension. Sitting in doctor's chamber, anxiety causes it. There are isolated systolic hypertension in thyrotoxicosis, anemia, very common. Gestational hypertension is very common. Hypertensive crisis, as I told you, urgencies and emergency. When it is called as an emergency, when there is a stroke, or cardiovascular disease like an acute coronary syndrome or heart failure, these are the various symptoms. The complications of hypertension, as I told you, the TOD start from the brain, heart, eye, peripheral vascular disease, and renal. These are the target organs which are damaged. When there is a blood pressure, how to evaluate? This is the algorithm for evaluation. When there is an acute elevation of blood pressure, not a known chap, suddenly comes to about 200 by 120, acute elevation, you will have to see the physical line, look for end organ damage, immediately see the fundus, see the cardiovascular system and the urea. When it is affected, it's an emergency. Not affected, it's an urgency. In emergency, you will have to look for aortic dissection, heart failure, acute tubular necrosis, stroke, preeclampsia or eclampsia. Based on that, you evaluate and start treating. Immediately blood pressure must be reduced. Chronic. There are history of symptoms and signs, physical examination, do an ECG, X-ray, renal function, echo, target organ damage, and always look for secondary causes of hypertension. Maybe vasculitis. And on the treatment side, this is a very simple format I have given you. First and most important is for the lifestyle. That I'll just come to it, what are the lifestyle. Then is the drugs. When you come to the drugs, you will have to go in for oral drug, parenteral drug, sublingual drug. Sublingual are rarely used now. Oral and parenteral for emergency. We use this vasodilator, nitroglycerin, beta blockers, intravenous Inderal, or AC inhibitors, or calcium channel blocker, or alpha agonist, or D1 receptor agonist. Phenobarbital is a very rare drug. Orally, we have all these combinations are available, which all of us know. And after that, you will have to step down the therapy if need be an intervention. When there is a cardiac and there is a renal, or when there is a cerebral, we need to intervene here. Indian BP guidelines recommendations mean when the blood pressure is high normal or no drug therapy, lifestyle is enough. When the target is less than 130 or 140, the age is above 60, focus on non-pharmacological therapy only and focus on stopping smoking. Hard to control hypertension. I am taking drugs, I am not able to control the blood pressure. Either doctor says or patient says it's a white coat hypertension, poor drug choice and combinations. And secondary hypertension, you will have to look for like aldosterone excess or obstructive sleep apnea, and BP raising drug, maybe on NSAID or cold remedies, they are all and potential vasostimulants, and high salt diet and a volume overload. Above all, poor adherence to therapy. Drug-induced medication that can interfere with the BP control, mainly the non-steroidal anti-inflammatory drugs, oral contraceptives, and sympathetic drugs like even a cold medicine or a nasal drops can interfere here. Alcohol, antidepressants, cyclosporine, erythropoietin, enormous number of herbal compounds are there. It's an era of Ayush coming up. Therefore, a lot of mixing is taking place. This mixopathy is a common cause for resistant hypertension. And patients always ask, why should I take 2 or more medications? The answer is everyone responds differently. Somebody needs more than one. We always work for the best, can take time to fully get control. These are the queries which the patients ask, which we should be ready with the answers. When you are a hypertensive, when you exhibit drugs, you will have to avoid certain drugs. Suppose patient has got a bronchial asthma and there are rhonchi, you will have to avoid beta blockers. When there is a gout, diuretic, especially thiazides, otherwise you will go on increasing. When there is heart block, don't use beta blocker. When there is heart failure, beta blockers don't use. It's a general statement. Of course, the cardio-selective selectively can be chosen. In there is a liver disease, certain drug, especially methyl dopa, cannot be used. When peripheral vascular disease, beta blockers cannot be used. In pregnancy, AC inhibitors, ARB, contraindicated. Renal failure, potassium sparing agents riskier. Renovascular, again the ARB and AC are highly riskier. These we should keep in mind before starting therapy. Now the therapy of hypertension, first we will start with the non-drug therapy. First is called the lifestyle management. Salt reduction and the DASH diet, I'll come to it. And eat healthy, exercise, yoga, weight loss, quit smoking, reduce alcohol. Everybody feels that alcohol in moderation is fine. But I, for the one who always recommend alcohol is not acceptable to our Indian hypertensive patients. And even the sleep has to be, adequate. Coming to the salt, normally we take about 8 to 10 grams of salt. It must be reduced to 3 grams. I used to say that if you can avoid a few foods, like these puppets, and then this idli. In South India, we use idli pudi and fried things, and then this fishes put into that. All a few things that pickles. We use a lot of salts. We should avoid and add very little salt. This is dad's diet. It's a dietary approach to stop hypertension. There's nothing but there is an emphasis on fruits and vegetables and low salts and dried beans and nuts are all there. The DASH diet was very popular earlier. Now many modifications have come. These are all the foods which are healthy. These are all the foods which are poison, which has to be avoided or sparingly used. And the fast food, all fast foods, our young children are very much fond of it. Colored foods versus the colorful foods. We can take colorful foods, but colored foods have to be reduced. The green leaves and vegetables are colorful. And eat right is a government of India. There is a food called parota. In North India, we call it as a naan. All these things have a lot of calories, lot of fat. They are very much bad. And there is, physical activity always improves the hypertension. And always we should keep it in mind. It can be an aerobic exercise or anaerobic exercise, outdoor exercise, or indoor exercise you will have to do. Brisk walking is the best. And even your own, engaging in your own day-to-day work, like washing your car and coming up and going down the stairs will always be useful. When the physical activity is adequate, it can lower the blood pressure up to 10 millimeters of mercury. As we made a study there, when there is a 10 millimeters reduction, there is enormous number of saving on the life of the patients and bad complications do not come. This is the benefits of exercise to hypertension, helps to control blood pressure, strengthens the heart, improves muscle, and improves circulation, improves sleep, and even your stress is coming down. Therefore, if you want to live well with hypertension, you must do physical activity. Yogas, asanas, pranayam are always very, very useful. And weight reduction is an important one. If you can lose 10 kilos of blood, weight, even your blood pressure comes to about 20 millimeters of mercury. Smoking, number of cigarettes, all we don't count. We'll have to stop it. Alcohol also, we have to stop it. And there is a lifestyle modification, as I told you, when there is a 1 kilogram of reduction of weight, 1 millimeter of blood pressure comes down. When there is 10 kilograms reduced, 10 millimeters of mercury is always comes down. There is a study based on the exercise, what is called as entry study. It's a very interesting, randomized controlled study. It says when you do exercise, the ambulatory systolic blood pressure always comes down. In the control group and the exercise group, it definitely comes down. It's a proof. And always you must have a good sleep. You must stick to a sleep schedule, and your naps have to be, reduced. And what you eat and drink before the food and before sleep is very, very important. And doctors, I am very much concerned because many of the doctors have hypertension. You may ask why. I used to say two things. Number one, they are having a sitting posture and asking the patient. They don't have physical activity during their life. Number two, they are very much stressed. In today's medical legal scenario of the medical profession, every doctor, citizen is looked upon as a litigant, and their questions and what they see in the internet and coming and torturing the doctors puts them into stress. Therefore, burnouts are very common. Healthcare violence is common. Medical legal claimant and right to health is yet to come, which we are finding it. And you will have to, reduce the stress and always try to target too much and do more. Always you reduce it, and you will have to have some, gratitude in the profession. The stress management summary comes here is you must get enough sleep, you must do enough exercise, time you must have to relax, count down the number of stimulants, you keep on seeing the patient, other side keep on eating coffee, limit the alcohol use, which I already said, always avoid use, take care of your health and lifestyle. You are advising your patients, now take care of your health and your lifestyle also. There are certain myths about hypertension. High blood pressure runs in my family, there is nothing I can do to prevent it. No, you can still prevent it. I don't use table salt, therefore I need not control my blood pressure. That is also not right. I don't have to worry about high blood pressure because I am feeling fine. As I told you in the opening, I am comfortable. I'm able to do my work. I don't have a giddiness. Then why should I bother about blood pressure? No. And now I was diagnosed earlier as hypertension. After drug, it has been brought down. Now can I stop my drugs? These are all the myths about hypertension. People, somebody says people with high BP always nervous, sweating. No, it is not. I read that wine is good for the heart, which means I can drink as much I want. Wine was, then in Paris, and for our Paris people, it is fine. But for Indian people, no. It also comes under alcohol. I have checked my blood pressure, my doctor check it for me. This means that I don't need to check. No. At home monitoring is an order. Always measure the BP and confirm. A regular monitoring of the blood pressure is needed. For checking the blood pressure, you need not go to a healthcare worker or a doctor. Now, even if you keep your finger on your mobile, BP is coming. Or a home monitoring blood pressures are available. Try to monitor your blood sugar. Blood pressure. Every day. Like that, blood sugar also, you yourself should be able to control. Know what is right, what is wrong, what is low, what is high. And if you need, you can always disturb your doctor. This is the assessment and management of hypertension. Now everything is telemedicine today. Now you can sit in your home or office, your doctor can monitor, or your healthcare workforce. Therefore, it's a very important one. There are, a lot of studies on that. When there is blood pressure monitoring, systolic blood pressure monitoring, over the months, always the blood pressure, both systolic and diastolic, comes down very well when you start monitoring. So that once you know that your blood pressure is high, you will always do a good lifestyle, and drug also will adjust. And the strategies to deal with uncontrolled hypertension is simply you may have to use a 2-drug or 3-drug combination. And patients also be involved in blood pressure management. Don't neglect your older patient. Don't give up non-drug therapy. Non-drug therapy is part and part of treatment. Of diabetes, hypertension, cardiovascular disease. And along with that, when it is not controlled, you go for, drug therapy. Non-adherence is an important one. As I told you, there are 3-4 drugs. Who should they take? They'll take one, or sometimes they leave. That is number one. Number two, they will feel that they are comfortable. And when there is a non-adherence, always the incidence of non-adherence throughout the world is very high. That leads to a lot of complications. Now, ladies and gentlemen, the ABCD of managing hypertension and living healthy is avoid alcohol, not reduce. Be physically active. Cut down your salt. Don't use tobacco products in any form. Eat vegetables, fruits, and green. Follow drugs regularly. That's a way to live healthy, after hypertension. And the summary of the discussion is A prevention of hypertension is possible. If you know that your family, your father, mother, your brothers have hypertension, always start the prevention. Number one, healthy eating. Less eating, less salt. And maintain adequate weight or reduce the weight. Be physically active. Even if you are doing an office job, try to walk every day at least 30 to 40 minutes. And manage stress. Stress is unavoidable. How you take up the issues is the cause for stress. Therefore, you learn to take up things easily, stress will be less. And limit alcohol, I always like to differ. Stop alcohol and stop smoking. For the control of it, in spite of it, you have hypertension. You adopt the prevention steps, adopt the DASH diet with low salt, take medications as directed by the physician, know what your BP should be, and you monitor your blood pressure. Now, ladies and gentlemen, I would like to close down. Living well with hypertension is possible when you know to prevent or control hypertension. Thank you very much. I am sure I have conveyed you the message very clearly. If anybody would like to, offer some more inputs, I will love to learn. Thank you. Thank you all very much.
Thank you so much, sir, for this informative discussion. And sir, may I stop your screen share? Yes, sir. Perfect, sir. Sir, we have received a couple of questions from our participating doctors. Just allow me to put them across.
Please. Hello.
Yes, sir. I hope my screen is visible.
Yeah. Can I go ahead with the answer?
Yes, sir.
See, the hypertension management in elderly patients and young. Very interesting question. See, in elderly people, the target levels are 10 millimeter high. Therefore, we should see that the blood pressure is not brought down, to a very low level, number one. Number two, they are usually having an atherosclerosis and will have a target organ damage, either eye or brain or heart or kidney. Always check that. Based on that, you put them on drugs. Better avoid beta blockers for them. If it is necessary, you can always take a cardioselective beta blocker. Whereas in young adults, you will have to aggressively treat and you will have to start them on vasodilators and ACE/ARB and beta blockers. And you will have to always look into secondary causes. Usually a renal cause will be there. Yeah, many times we have seen coarctation or an abdominal aortic aortitis or any of the infections of the vessel wall can always be there. That should be looked into, not casually putting them on tablets. Okay. There is enormous number of interaction. As I told you, I gave you the list. Simple cold remedies. Those who has, the ephedrine or earlier you used to use an Actifed, all of them have sympathomimetics. They always raise the blood pressure. Secondly, the beta blockers that we use the drug for hypertension. If you have a respiratory infection or a known COPD or asthmatic fellow, yeah, a wheezing can be precipitated. If they are a pregnancy, you can't use this ACE/ARB and renal. Also, we will have to see that urea creatine EGFR are not raised. You will have to be very careful in choosing the drugs. Therefore, we need to do that. Yes. Can go over to the next one. See, the salt restriction normally, as I told you, it's about 6 to 10 grams of salt we take every day. But we have now for hypertension, we can use only up to 3 grams. And you will have to counsel the patient, see that you will have to always modulate the diet. The dietitian, fine, otherwise a clinician has to do that. The food is a very important component of human being's life and it should be tasty. If you totally, ban the salt, nobody can eat the food. You should see that the food is having less salt, having but taste, so that they are able to enjoy their food. That is what I told you, the pickles and the dry fish and the puppets and lot of other side things we keep in the, food. All those things we used to avoid. And you can fairly use a salt in your day-to-day food. Sometimes I used to counsel, you don't add salt to your rice, but you can add salt to your the sauce and the vegetables, curries we can add. That way you'll have to make the patient accept that salt restriction has to be there, but he enjoys his food and his BP is under control. Okay. See, there are long-term side effects available with the drugs. I agree with you. That can be, either renal complications or can be lung complications, or there can be a cardiac suppression. You should know what group of drug will cause what. And that is why the clinician's visit is important. You do a home blood pressure monitoring, but a clinician should keep on seeing you. See, when you see the clinician, not only BP control, target also. He'll check your heart, whether it is enlarged, left ventricular hypertrophy is there, or you have heart failure, or you have renal failure, or a peripheral pulses. Based on that, he has to modify the drug. And then the anti-hypertensive medications causing you the side effects can always be detected early and avoided. See that you have a good control of the blood pressure with least or minimal complications. Sometimes sleep may not be there. You need to do that. See, it's a very important, hypertension, obstructive sleep apnea syndrome are now cousins. They go on very well. Always when there is a resistant hypertension, you are treating 3 drugs, 4 drugs, 5 drugs, and the blood pressure is not getting control, you will have to look for secondary hypertension or sleep apnea syndrome, obstructive sleep apnea, OSA. If you slightly do the maneuvers for the obstructive sleep apnea, BP will definitely come down, because this is a sympathomimetic stimulant and raises the blood pressure. Always you will have to see that, and there are enormous number of manuals are available, and you have some sleep labs. You can go for a study, and you have got a fittings into the mouth which you can have it and try to sleep. I see many doctors, even they'll put something like a mouth gag. They'll keep the tongue down so that the airway is kept open and goes well, and blood pressure is also controlled. Okay.
Yes, sir.
Done?
Thank you. Yes, sir. These all are the questions, sir, for today's session. Thank you for answering all the queries from our participating doctors, sir, and thank you for sharing such valuable insights with us. Thank you so much, sir. Have a good day.
Can you share me a copy of this recording?
Definitely, sir.
You must share it.
Yes,
Please.
sir. Our team will provide you that.
Okay.
Thank you, sir.
Thank you.